Well, health insurance costs will go up again next year for Vermonters, but at a rate much smaller than what was expected. That's because the board that oversees healthcare in the state approved minimal rate increases after health insurance providers asked to raise their rates by, in one case, as much as 23%. ABC 22's Matt Holderman heard from insurers and members of the Green Mountain Care Board today. He's now live in the newsroom tonight. Matt?
Thanks, Lauren. Yeah, members of the Green Mountain Care Board shared the rate increases that they are approving this past Friday night, and they're not letting any company raise prices for any plan by more than 10%. They say that although Vermonters do still pay some of the highest health insurance premiums in the country, they think people should be happy with these small increases, knowing how big they could have been.
The board ultimately reduced the insurance company's requests quite significantly.
Monday afternoon at their Montpelier headquarters, leaders of the Green Mountain Care Board explained the price increases they're allowing health insurance companies to charge in 2026. Care Board data shows Blue Cross Blue Shield Vermont asked to raise the cost of individual health insurance plans by 23.5% next year and asked to hike small group rates by 13.5%. Instead of letting the 23.5% increase go through, the Care Board approved a 9.6% increase for BCBS individuals and 4.4% for small group. Meanwhile, MVP Health Plan Inc. asked to raise their 2026 rates for those same plans by 6.2 and 7.5% respectively. The Care Board only let those numbers go up by 1.3 and 2.5%. In total, Chair Owen Foster says that should save Vermonters $68.8 million compared to what the companies wanted to charge.
We concluded that allowing these giant rate increases would be very detrimental to people's ability to access care, and that the status quo of double-digit rate increases was not acceptable. But overall, I think that Vermonters should be very pleased that they're far less than what had been initially anticipated.
Blue Cross Blue Shield and MVP released statements on their original rate increase requests being denied, both seeming to be okay with it. BCBS tells me, quote, "A lot has changed since we filed these rates back in early May. We are very supportive of the GMCB's efforts to bring down the cost of care. Affordability matters." And an MVP rep says, quote, "These modest rate adjustments are a testament to collective efforts to responsibly manage costs. We thank the board for its thorough review." Although both insurers seem to be accepting, they do have 30 days to appeal the Care Board's decision, and Foster says they have received appeals in the past. He also notes that some other nearby states like Maine and Connecticut look like they will have rate increases of 15% or higher, so he thinks Vermont compares quite favorably this year. Reporting live in the newsroom, Matt Holderman, ABC 22 News.